Hey, it's Glenn the Flying Dutchman, and welcome to this brand new segment called Health Sense on 1FM 91.3, brought to you by Glen Eagles Hospital, Singapore, on your side.
So Health Sense is a monthly series. We're going to be talking to a collective of medical and wellness specialists about a wide range of health matters.
And the theme for today is Get Your Heart Racing. Up next, we have Dr. KOK, who will be talking about heartburn and maybe acid reflux.
Dr. GWEE is a gastroenterologist with the Glen Eagles Hospital, Singapore. Dr. GWEE, thank you so much for joining us. I did pronounce that right? Gastroenterology. It's one of those words you always worry that you don't pronounce correctly.
You're right.
Okay. On diet, how much and what type of foods should one consume before one exercises?
Yeah, so I think that depends on the type of exercise you're going for.
Okay.
And what you're trying to achieve. So like if you're talking about an F1 race, then you want energy.
Yeah.
If you're talking about something that's very muscular, you want proteins. And then the timing will also depend also on what you're trying to achieve. So if you want a lot of quick energy, then you want easily digested food. And that's when, let's say if you say white rice, that will be the best. Just before an exercise, you get lots of energy boost. But if you want a sustained energy, then you go for brown rice, because then it comes in later. The digestion is a bit slower, more sustained.
So if I'm going, say I'm going to the gym at 2, when should I be eating then?
Usually we recommend 2 hours before any exercise.
2 hours.
Why is it? Because, I mean, growing up, my mom used to tell me as well, if you're going to the gym, don't eat and then immediately work out. If not, you'll get appendicitis. Is there any truth in that?
Yeah, you're right. It's a lot of
Right.
old mother's tales. I've been subjected to it as well.
Yeah.
In fact, that's one of the motivation for me to learn about how my gut works so I can prove them wrong.
Let's talk heartburn for a while.
Okay.
Shall we? What is heartburn and how do I prevent it?
Heartburn refers to this warm sensation rising from here right across up the middle of the chest, usually attributed to acid reflux. That means acid from the stomach going upwards instead of downwards. And then the acid kind of irritates the esophagus. So that's heartburn.
Is that a common thing? Because I've never experienced that.
Yeah, it in some sense it is common, but it's often overdiagnosed as well. That means many patients with any chest complaint, and some of them will even tell me that heartburn is down here, so there's a lot of hype about it.
Right.
But ultimately, what we need to know as a gastroenterologist is what's going on inside. So we want to see if there's any erosion of the esophagus, whether there's really any inflammation at all. In fact, acid reflux, a certain small amount of acid coming up to the esophagus is normal, because when we've done physiological tests, we find that most people have a bit of acid coming up 4% of the time. So it's not necessarily always harmful.
Right.
Yeah.
But there is such a thing as chronic acid reflux, isn't there? Where people actually suffer from acid reflux.
Yes, sure. So those are the patients that we attribute as having gastroesophageal reflux disease.
Okay.
And that's when acid comes out, burns the esophagus, and then it's inflamed and sometimes even ulcerated.
Oh, wow.
So what would you call something that, I don't know whether it's reflux as well, but many people, and I notice it's the women who get
Bloating.
this bloatedness,
Yeah.
and they feel very uncomfortable in their tummies. Got lots of friends, right? And I realized that the guys don't quite have as much of this problem as the women. Is there any truth in that?
Yes and no. I mean, I think bloating is an extremely common complaint that we face, both in guys and ladies. But certainly, I think understandably, the ladies are more affected by it. Partly cosmetic, because they come to me and they say, I'm good in the morning. By the evening, I look like I'm 3 months, 6 months pregnant. Yeah, so it's a bit embarrassing that way. So the distension is real because they can actually see it. And some of them don't see it but just feel it. But extremely common complaint. And so a lot of times this is attributed to reflux. But honestly, most of the time when we looked into patients with bloating, we don't see reflux. But I can tell you that a lot of doctors will attribute it to reflux.
Well, what causes it then?
Yeah.
The common obvious one will be gas.
Okay.
So the best way to tell whether it's gas is you ask the person, when you're bloated, if you were able to discharge some gas, does the bloating go off? The other common cause for bloating, in my experience, is constipation. Finally, a lot of patients don't seem to be able to perceive that they're constipated. They think they're going every day, but they don't realize they haven't cleared it completely, or that they've put in more stuff than they've been able to clear out. And this is why, maybe partly why women are a bit more prone to bloating, because as a group, women are creatures who are more prone to constipation than guys. I often have couples, the lady is the one who will say, she can only go once in 3 days, but the partner, the guy, will be going 3 times a day.
Let's talk food trends, okay? This current food trend of mala. I have a daughter who is mala crazy. She eats it until her mouth goes numb. Absolutely crazy, right? But growing up, I was always taught spicy food and you'll get heartburn. Is that true? The more spicy your food is, the worse the heartburn?
There is some truth in that, but the scientific evidence is not strong. And interestingly, the proof for it comes from some research here in Singapore. One of my colleagues in the National University actually has this research where he gets volunteers to drink a whole bowl of curry, a pint of curry like this.
Oh no.
As a challenge test, and then he showed that you could induce reflux that way. But mala, I looked it up, there's no research done. So the closest we can get is this curry challenge test.
Oh wow.
But doctor, isn't a lot of this common sense as well? Mala being as spicy as it is, and after consuming it, your mouth feels like it's on fire and your tummy feels like it's on fire. That can't be good, right?
Yes and no. Okay, so mala has 2 components. There's the oil and there's the spice.
Yes.
Yeah, so probably it's the spice, probably it's the heat of the oil that's more damaging than the spice per se. So this is where a lot of our old wise mothers' ideas are totally wrong. They used to attribute stomach ulcers to eating spicy food. They couldn't be more wrong, because the people who ate more chilies actually have the strongest stomachs. And actually there's scientific evidence that chili makes the stomach lining stronger.
Oh wow.
Well, I see, this is interesting.
This is great news.
This is interesting because most people eat chili with their food.
Yeah.
But you've been out with my wife Michelle and myself.
Yes.
And she eats food with her chili.
Yeah.
It's completely different. She loves her chili. But I want to get back to acid reflux for a while. If this is a problem, do we need to change our exercise routines if we have acid reflux?
Yes, there is such a thing as exercise-induced acid reflux. So the advice I give to my patients, I usually like to start off with a very facetious kind of example, so that they get a good understanding of how acid reflux comes about. I tell them, let's say you go out, have a big buffet meal, and then after that go and stand on your head. You're almost definitely going to get acid reflux, right?
Right.
I once made this joke to one of my patients, and then she stared at me and said, but I do that all the time.
What?
And she's got this thing called a hiatal hernia, where the valve is really loose and open. There's this yoga practice where you're supposed to stand on your head.
Your hands are in a V and you
Stand on your head.
Yeah.
So she was doing that.
No problem.
She has the worst reflux I've seen, and her valve is all open, and she listened to this guru who told her to go and stand on her head, and she did it, and
So what happened afterwards?
So I've got to tell her, you stop doing that. So the way that we try to minimize reflux is to tell people, eat as light as you can, especially towards the end of the day, and then try not to lie down or sit down, well, not to lie down at least for 4 hours. And the ideal would be after a meal, stand up, walk around, because gravity will help you to push the food down.
Does acid reflux then, with some people believe, that acid reflux means I've got bad digestion? Are the two connected?
Well, the word digestion is used just so loosely.
Loosely.
Yeah, more times than not, it's the bloating that people attribute as bad digestion.
Right.
Whereas the acid reflux is more acidity related in many people's mind.
How serious a condition is acid reflux?
Acid reflux can lead to erosions, ulceration of the esophagus, which can lead to bleeding, which can lead to scarring, which in some people may increase the risk of esophageal cancer in a small percentage. Very, very small percentage. Very small percentage.
Once I have that ulcerated condition, what's the kind of treatment that the person would have to go through?
Well, actually treating acid reflux couldn't be easier because there are fantastic, highly effective drugs. They've been around for a long time, they all work. So in a sense, if we gave patients acid blockers and they were still not feeling better, more times than not, they don't really have acid reflux. So in a way, we call it a test.
Oh, wow. So literally, you need to test the person with the drugs to confirm whether they have it or not.
That's one approach. So like if you're if you're not an endoscopist like myself,
right,
and you say you're a GP and your patient comes to you and you're not sure if it's acid reflux, heartburn or not, you give them a course of this acid blockers, say for a month, and then come back. If you're better, yes. If you're not better, it's highly unlikely to be acid reflux.
If I'm a person who suffers from acid reflux, what sort of foods should I stay away from? What sort of food should I increase?
Well, so spicy food, as we discussed, curries, they say coffee, they say alcohol. Alcohol for sure, there are certain alcohols that are highly acidic, so the white wines, the champagnes. But to me, more importantly, is the amount. If you eat big meals, you're going to stretch your stomach, you're going to stretch open the valve, and the pressures will be higher, you're more likely to induce reflux. I personally think that coffee is way overblamed. I don't think it's as bad as people make it out to be, especially if you're drinking a small amount. In fact, they've never been able to show an association between coffee and acid reflux in properly conducted scientific studies.
Right. But are there certain coffees that are more acidic than others?
Yeah, sure.
There might be, but it's still not
the amount of the acidity in coffee is actually not that bad. In fact, I was just looking it up. Apparently, honey is more acidic than even coffee.
Honey is more acidic than, because I take honey with my tea.
But you have no problems.
I don't have acid reflux. I don't. Would exercise help me with this? But
if it helps you to lose weight, yeah, sure.
Then it does.
Yeah, but if you got, like I said, a full tummy, you're going to exercise, you're going to throw the acid up.
Right.
Okay.
Which is why I always tell you and the boys, Sean and Andre, if you're feeling bloated, right, the best way is to just fart.
Yes, this has always been.
It does help.
It does help for sure.
Glenn's solution to most things is break wind.
Yeah.
No, I
because
think
if you keep it in, that's when you're going to feel really, really uncomfortable.
No,
and I would advise like the ladies as well, because I think the ladies are very polite, so they always hold everything in. Maybe that's why they're feeling
I think you've got a point there, because a lot of my patients come in and they say I'm bloated and I keep burping.
Yeah.
But actually burping is the worst thing for reflux, because when you burp, you're opening up the valve and you bring it up. Yeah.
So it's different.
Then when you tell them, why don't you let it out the other way? And then if you could, would you feel better? They say, yes, actually they feel better when they let it out the other way. But maybe they're a bit inhibited and then they feel it's better to go up this way. And burping didn't help them at all.
So I need to ask you a question, because I do get bloating every once in a while, and he always tells me, break wind, that's the way to get rid of it. But sometimes I just can't. Is there medication that will help me do this?
There are some defoaming agents that do help the gas bubbles to come together and make it easier for someone to just discharge it.
Yeah.
Wow.
Then I was teaching you that method as well. Just keep on rubbing and pressing your tummy. But after about 3 minutes.
But you should go clockwise.
Get there.
You should go
clockwise. Oh wait, hang on. I thought this was a joke. This actually works?
Well, you're following the direction of the colon. So you're trying to encourage it to move.
So I'm going
clockwise.
Clockwise?
Yeah.
See, this is why it hasn't worked. You just told me to rub it, so I just do it naturally. And I've been going the wrong way.
Yeah, this is clockwise. Right.
So maybe this, if I started to rub it the right way, it might disappear.
And then just first you dab a few drops of Hong Yu first. And then, I'm serious, I'm not kidding.
I don't know about Hong Yu, but my wife, when I get bloated, my wife uses peppermint oil.
Yes, peppermint does help. Because peppermint relaxes the smooth muscles. But then one downside of peppermint is it could actually induce acid reflux because it will relax the valve here, and then you also get a lot of stuff coming out like gas and acid sometimes.
Oh, I have to tell her that. Because my wife uses peppermint to cure everything. It's like a cure-all for her. You've got a headache, you use peppermint. You got bloatedness, you use peppermint. You use absolutely anything.
Doctor, I've got a question here from someone who asks, why do I get diarrhea during intensive exercise?
Actually, that's quite a well recognized phenomenon. So there's this thing where marathon runners often find that midway they've got to take a break and go and poop with diarrhea. I don't think people really know, but one suspicion is it could be ischemia, that you haven't got enough blood flowing because of the intense exercise, and then that means the gut's kind of getting inflamed. So that's one thing. But the other thing is also that it depends on their eating pattern. And maybe that's one reason not to eat too much before a run.
Yep.
So if you had a lot to eat and then you're running, at some point in time it needs to come out, but also depends on what you drink before that.
Right.
So I had an interesting patient the other day who asked me exactly the same thing. And then after going into details about his routine, then I realized that he would drink a cup of coffee first and then go for a run. And then the night before he'll eat lots of fruits. And these are all kind of stuff that will build you up for a good poo in the morning. So ideally what these people should do is get up early, have your coffee, make sure you clear your bowels before you go out. So if you've emptied your bowels, then you go for a run, then you're less likely to have something that you need to evacuate. It's also because they tend to do their intense exercise and workout in the morning. And the morning, physiologically, is a time when most people naturally move their bowels.
That's interesting. So we should be doing our intense exercise when then?
When you
Afternoon,
time.
afternoon, evenings probably.
Anytime, yeah.
Yeah.
As long as we stay away from the morning, or unless we've cleared ourselves.
So in my opinion, the natural way that our body functions, the priority in the morning is breakfast and having a good poo.
Right.
Everything else is secondary. So I've got patients that go the other way around because they've got this gym thing. So they'll wake up, and these tend to be ladies. They'll wake up and then they won't eat much. They go to the gym, and then after that they don't have any stimulus to have a bowel movement, and they're constipated. Tell them to stop going to the gym, have your breakfast, drink your coffee, and they can move their bowels.
Yeah. I find oatmeal in the morning very useful. Is that...
Well, oatmeal distends the stomach, and anything that distends the stomach does send a signal to the bowels to evacuate. But for that matter, you could eat any other kind of big meal. Yeah, but my thing about oatmeal is that it will cause bloating. It's a high...
See, he uses oatmeal. My wife, on the other hand, has gotten into a habit, and we're now doing this on a daily basis, and it's about a glass about this size. And it's basically water and vegetables blended, and we consume it. And we find that works really well for us, as opposed to oatmeal.
That works very well to create bloating.
Really?
Yes. Yeah.
Why?
So it's not for everyone.
Well, no, actually, it is for everyone. It's just a question of quantity and how sensitive we are.
Right.
So we've all become so hung up about healthy.
Yeah.
And a lot of healthy eating is predicated on eating fiber, vegetables, and so on.
Yes.
But what we forget is that fundamentally, plant cells have got a thick cell wall with cellulose, and animal cells, thin cell membrane. Our human small intestine do not contain the cellulose digestive enzymes at all. But the animal cell is fully digested by the protein breakdown enzymes that we have. So if you ate meat, fish, chicken, animal protein, it'll be fully digested. If you ate plants, at best it'll be partially digested.
I wish we were talking about this earlier because we have so many people who are vegans right now.
Yeah.
So are you saying, doctor, that vegans perhaps may not necessarily have like the best digestive systems right now as a result of their plant-based
Again,
diet.
depends on what you think of as digestive system. I mean, sometimes they think that these fibers help to feed your good bacteria, and then that makes your processing of food better and so on. But this old concept that, again, many my aunties, mother, grandmother put down to us is like, oh, you know, vegetables are good for digestion. It's nothing further from the truth because they are indigestible. They are indigestible. Period.
Oh my goodness. You see, this is why I love this show. Every single doctor that's been on this show, I have learned something that I didn't know before today. Absolutely brilliant.
Thank goodness I'm no longer a vegan.
Glenn, you were only a vegan for 3 days.
Yeah, I tried it. I didn't like it.
Dr. GWEE, thank you so much for sharing with us. It has been absolutely amazing. Thank you.
Thank you.
Good times. Greatest hits. 1FM 91.3.